first week of November is observed as National Radiologic Technology Week. If you've ever had a CT scan, X-ray, mammogram, or any type of medical imaging, you have been a beneficiary of radiology.
Our Grace Brister visited the OCH Regional Medical Center to learn more, and she joins us live here in the studio. Grace.
The X-ray was invented during this week back in 1895. Sometimes these exams can be difficult for patients due to a busy schedule or fear of the machines. A local woman in Starkville says that is not the case for her, and she doesn't want it to be with you.
Robbie Richardson has seen her fair share of medical scans throughout her life. Over the years, she's battled breast cancer and colon cancer, but things took a turn when she went into cardiac death.
Paramedics came to my home, shocked my heart, and was able for me to breathe. But I coded 6 more times that night at the hospital.
After her trip to OCH Regional Medical Center, she was later transferred to a hospital in Jackson for further treatment. But Richardson says she was thankful that when things needed to be checked, the need to be checked was met quickly and locally. Richardson still has regular checkups to make sure her heart is well, and earlier this week she had an appointment.
I saw my primary care doctor. He said, "We need to have this checked." He wrote the order. I walked across the street to my hospital, and within an hour, the procedure or the test was run. You know, we don't live in a large town. We think Stark Vegas is big, but it really isn't. Without the radiology being available and qualified staff to operate that equipment, I wouldn't be here.
Director of Radiology Andrea Williams and Assistant Director Ashley Zerweller say getting scans is important because they can detect underlying or developing issues.
Early detection of anything, it can be preventative, can save of diseases progressing.
Mammograms, CT calcium scoring, CT lung cancer screenings are super important in the diagnosis and early detection of breast cancer, coronary artery disease, and possible chances of lung cancer.
Zerweller says that the machines that do the scans can make patients feel uneasy, but she says once they explain the exam to the patient, they are put more at ease.
I think a lot of patients are scared of the radiation, which the majority of our x-rays, if you're doing a chest x-ray or 3 views of the wrist, a lot of those are going to be the same amount of radiation you're going to get from just daily background living.
What you have to fear is not having it checked and it being worse. You're going to walk out of that procedure saying, "Whew, I'm glad I had that done."
For more information, you can visit och.org/radiology.